Hello everyone, welcome back to my YouTube channel. So this is Dr. Ravi here. I am from my clinic, Dubai again. So in today's video, we're going to talk about the back pain strengthening exercises. Okay. Now this exercises is made to make your back muscle very strong. So the patient you usually have a pain, a recurrent pain, again and again you have a back pain. These exercises are very essential and very useful. Okay, so before we talk for our back pain video, let me just thanks all my subscribers, all my family, friends and all my well-wishers. They help me a lot to spread my videos. They spread so many platforms and I really thanks each and everyone. They help me to grow this channel. And with this help, I really feel that very soon I can reach to the more people, and with this YouTube channel I can help so many patients. And that is my goal and the mission, to make the world pain free through my YouTube channel so I can help so many patients. Okay, now let's come back to our today's video. So in today's video we're going to talk about the back pain strengthening exercises. So now which all patients first of all can do these exercises? The patient usually have a recurrent back pain. They usually have a back pain again and again even after taking a treatment. That means their back muscle is not powerful enough to hold their back. So these exercises are very useful for that. The next which kind of patient they can do? Suppose you have a back pain, you go to physiotherapy, you take medications, and after 5 days or 1 week, if your feeling is fine, so these exercises you can start doing, and this exercise will help you to make your strength of the back muscle. So chances of not having a back muscle or back pain again in the future will be very less. Okay. And mind you, if you know, we also have another back pain relief exercises. Make sure in the I button that I am putting, so this I button, there is a back pain normal relief exercises. So in case if you have a back pain, if you are following these exercises and for 1 week if you don't have any pain or something, so now you can start with these exercises. So I hope now the criteria is very clear which all patients can do, because you know my motto is very simple always. Instead of doing 100 exercises, I believe to do one simple exercises that is most effective. Okay, and my criteria of doing exercises and showing these exercises are that any age of the patient, whether it's young patient or might be old age patient, all they can follow the exercises. That is the aim, because I don't know, might be your young age or old age, so I have to consider that as well, and that's way I'm going to show the exercise. Okay, now so in today's video I hope the criteria of doing exercise is very clear. So we're going to directly to go for our exercises. So we jump to the exercises. So here we go for our first exercise. So in this first exercise is very simple exercises that you have to just tuck the tummy, okay, in the position I am going to show you. So first of all, you will lie down in the bed on your back like this way, and just put your hands here and just pull your tummy downwards towards the bed like this way. You have to hold for 5 seconds, and this way you will repeat for 10 times. So once again you just observe my tummy. I am just holding it, and you have to hold for 5 seconds. In case some patients not able to hold for 5 seconds, they can hold for 3 seconds or might be 1 second. Like this way you have to finish 10 repetitions. And now in this exercise, what I prefer, in case if you're not able to hold, so some patients they can just take the tummy and also they can release the tummy. Okay, take the tummy, release the tummy. And in case if you are holding, make sure you continue the breathing, because sometimes patients holding like this. This is not right exercise. You have to relaxly tuck the tummy and hold it for a while and then release it. Okay. Now, if you are doing with me all this exercise, make sure you pause the video and then you just continue to do the exercise. Finish the 10 times, then move forward to watch this video. So now we finish our first exercise. Now we are going to move for our next exercise. So in this next exercise, you again lie down on your back. Now what you are going to do, now you put your hands here, or some patients can put their hands here. In this exercise, you will bend your knee, and with bending knee, you just take this one up. You can see my angle is 90-90. If you can do like this way, hold for 1 to 5 seconds is wonderful. Hold it for 1, 2, 3, 4, 5, then release. Again, you will do like this, 1, 2, 3, 4, 5, and release. Okay, the same exercise you will repeat for 10 times. In case if you feel, if you're not comfortable to hold for 5 seconds, you can just take your like this way and just put it down like this. This is very easy and fine to do that. So now we're going to move for our next exercise. So now we are coming to our third exercise. So in the third exercise, you again lie down on the back and you just take your knee as much as near to your buttocks, and now you're trying to lift your pelvis like this way and hold for 5 seconds and then put it down. Again like this, hold it for a while and put it down. In case if not able to hold again, you can hold for 1 second or you can hold for 3 seconds, or might be you can just take it up as much as possible and lift it down. But make sure you take fully up as much as possible like this way, because I have seen some patients doing like this way. So this is not good. If you do like this way properly, then it will be something good. So you have to take fully up and down. Now if you are doing with me the 10 repetition, what I advise you again pause the video and just finish the 10 times, then do it. Okay. Now we are going to move forward for our next exercise. Okay. So now this is our fourth exercise and last exercise of this video. So in this exercise, you will lie down naturally. Okay. Now what you have to do, you have to press your heel down to the bed. Also you will press your head down to the bed like this way, and with the hand support, you will lift your full back up like this way. So you see how I am going to do. You can see me, and down. Again, just hold for 1, 2, 3, 4, 5 and down. If not able to see, I am just taking my hands and again see 1, 2, 3, 4, 5. Like this way, if you can hold, it is wonderful for 5 seconds if you can hold. Okay, now let me come sitting position and let me explain you why this exercise, the last exercise, is very important. In case some of the patient they are not able to do all of the 3 exercises due to some positioning problem, not able to do the tummy. But in case, at least if you can do the last exercise which I have shown you, it's a magical exercise. Because this exercise only if you can do for continuous for 2 to 3 months, automatically whatever recurrent back pain episodes you have, it will not come. Because what happened? This area, it's very responsible for holding your back. This is like base of your body. So this muscle, if it is not strong enough or they are not able to give proper support, so extra weight coming on your disc, and that's why you usually get a disc pain. So with this all exercises, you can make all this muscle is strong enough, and that way you will not put extra pressure on the disc, and the recurrent back pain or the patient who is having again and again back pain, that is not possible. Okay. So I hope now it's very clear to you. In case if you have any recent back pain, if you are not watching our first back pain release exercises, I advise all the patient and they supposed to do that first video, the back pain relief exercises, that you can find it on the I button and you can check that exercise. This exercise first you follow for the 1 week, I mean that back pain relief exercise. If you are not having any pain or something, then only you have to do all these exercises. Okay, I hope now it's very clear. Okay, now before to end up my video, let me tell you, if you are watching this video and if you feel with this video it is helping you nicely, it adds some value, or might be in your friends or family, someone they are suffering from a back pain, they have complained recurrent back pain again and again after taking even so many of physiotherapy or something, just make sure to share this video to them. So indirectly you're going to help them, as well as you're going to help my channel to grow, so I can help more and more people, because that is the ultimate goal for having this channel. Because in my schedule I have so many patients, and still for you only I am just spending extra time, and that is my commitment for my audience and for my all the subscribers. I will give you very value addition content on all of my videos. So I hope in my mission, if I am just having that much of efforts for you, you will also do little efforts, and if you like this video, make sure to like, and if you are the first subscriber or might be you are new to this channel, make sure you can check our introduction video, so you will have idea what is this channel and what is all about and why I am just having this video and this channel. Okay, with that thing, if you are not subscribed yet, I advise you or I request you, if you like and if you feel this is something worth value addition information, make sure to subscribe the channel and hit the bell icon. I will see you in my next video.